So it is my great pleasure now to introduce actually our academic hosts, because now I'm going to hand over to Erika and Laura, also known as Professoressa La Cascia and Dottoressa Ferraro, although you wouldn't have known them with a formal title. And they're going to take us through a journey of data, clinical experience, and a very important, valuable, and special surprise. So I'm not going to take any more time, and I'm going to hand over to, I think, Erika, you are starting?
Yes. Laura will give a very short presentation, then I begin.
Sorry, technical problems. No? Coming? Okay, slowing. Slow coming. Okay, here we are. So, good morning again, and you can skip to the other slide, because I'm going to present what we are going to talk about this part of the morning. We will start with some introduction from transsexual into gender dysphoria, so with some terms and history. And then we will have a brief chat with third-person accounts with Enrica and Gabriele, who kindly will share with us their experience. And then after the break, we will have a focus on research on transsexual and gender dysphoria that we have made here in Palermo. So, Erika, it's my pleasure to introduce you.
Thank you, Laura. Before all, I want to say thank you to Enrica and Gabriele. They are here with us, and then we will have a very easy, friendly chat. So please don't worry, okay? Our out-service patient is called tutto. In Italian language, tutto means everything, but is also an acronym because it's the human rights of transgender and transsexual people in setting of our general hospital. And is a project that was born about 6 years ago for an idea of Professor La Barbera, the head of a unit of psychiatry, and the Professor Adriana Cordova, the head of plastic surgery of the Palermo University Hospital. We have to make clear some difference when we talk about transsexualism and transgender, because, in Italian language, we use as if they are similar, words like sex and gender, but they have a different meaning, and for transgender people it's very important to divide it, to distinguish one from the other one. When we talk about sex, we refer to the biological, anatomical, physiological, and chromosomal differences and characteristics that define human beings are male or female. So they are universal variables that characterize male and female bodies. Is what we are when we were born, okay? Gender is a different term because it refers to ideas, behaviors, and attributes that society considers appropriate for each sex. So it's determined by social and cultural process. I mean, in Italy, you are a girl, you have pink dresses, you play with dolls, and you will be a ballet dancer like Carla Fracci, you know what I mean. But if you are a boy, you should dress always blue dresses, you have to play football, you will be like Messi, like Ronaldo, and you have to play running around the house and use a gun together with your friends. It's not always this true for our friends with gender dysphoria. Gender identity, it refers to one's perception and awareness of themselves as a male or female individual. It is the self-perception of one's sexual identity which does not necessarily coincide with the biological sex. Gender roles refers to the social expectation of what is considered adequate and appropriate for men and women. And the different words is sex orientation is not linked necessarily to gender identity or gender role, because sexual orientation speaks about what I prefer in my sexual and my sentimental and my affective relationship. So I can be heterosexual, homosexual, bisexual, and as asexual. On the basis of what I prefer. I prefer an individual of opposite gender, of my same gender. I'm not interested about sex, or I'm attracted both by male and female. Cisgender is a very large term. It just means a person who has a gender identity that matches the sex assigned at the birth. And transgender is a broader term that refers to individuals who do not recognize themselves in the two binary categories, male or female, retain the characteristic of both gender, or reject the social sex roles assigned to them from the birth. Individuals with gender features opposite to those of their biological sex who do not necessarily feel the need to undergo medical intervention to change their bodies towards a unique definition. Transsexualism is used to speak about individuals who do not recognize themselves in the biological sex of the birth and therefore transited to the other sex through hormonal and surgery treatments. Today we used to talk in terms of trans men to speak about individual who was born female and transit to become a man, and we talk about trans woman to talk about a male who become a female. Just some data about history, because transsexualism is a term that we don't find at the beginning of the phenomenon. One of the first data about who was the first trans woman, she was Lily Helbe. There is also a very interesting movie which is called The Danish Girl, and is about the 1930s. So she was a man who became a woman, and she was diagnosed with schizophrenia and treated for this. She underwent sex change surgery for 5 times, and the last one was fatal for her. The first who talked about, in terms of psychopathology, talked about transsexualism was Codwell, who talked about psychopathia transsexualis to speak about a girl who absolutely wanted to be a man. And he talked about a state of anguish related to rejecting one's anatomical sex. He was the first who distinguished between a biological sex and psychological sex. In 1915, the term transsexual was used to apply to all the individual who wished to become of the opposite sex through the use of hormones and surgery. She is Christian Jongerson. She was an American woman. He was born male. After he lived as a man, she started all the surgery and hormone treatment, and she became very, very famous all over the world. We can talk about her in terms of testimonial of a positive way to be a transsexual. Dr. Benjamin wrote the first, scientific book about the phenomenon, and he described the unknown syndrome that was different from other sexual disorders and began to treat patients with hormone therapy. What do we know about classification in terms of mental classification when we talk about transsexualism? First and second version edition of DSM didn't talk about transsexualism. We don't find in no one section, because the only section related with the sex is called the sexual deviation, but there is no words transsexualism and nothing like this. We have to wait the third and the fourth edition of DSM, where transsexualism is not used, but is used the definition of gender identity disorder. So it is underlined the presence of a disease, a disorder in terms of gender identification. And it is a persistent and strong cross-gender identification and a persistent unease with one's sex. Now we have the 5th edition of DSM, and we have a new way to speak about transsexualism. We don't talk anymore about disorders. We talk in terms of dysphoria. Patient with gender dysphoria, first of all, is an individual who has got a strong pain, who suffers from the not alignment of the perception personal in terms of psychological identity and biological identity. It's important the change of the terms because it's the first time that we go out from the psychopathology. I'm not a psychiatric patient only because I've got a transsexualism. I've got a clinic condition. If my living with my transsexualism means to be depressed, to live anxiety, and especially to be not accepted by the community and the society where I live. So dysphoria helps us to look at patients with gender dysphoria as people who could be fine if they could go on with their treatment and without the stigma from the society where these people live. And if we look at the words, we see terms like incongruous, desire, conviction, just to underline the need to proceed with the transition to the other sex. And when we will talk together with our friends, we will understand better how the mood can change, how they quality of life becomes much, much better than before when they also just begin hormone treatment, because it's the first step for I can't talk about a new life. I have to talk about through life for them. We can have a diagnosis also for children because, as all we know, dysphoria is present from the birth or the first years of our friends. When I ask them, when did you feel to be a female? Answer usually is always, I was so young that I cannot tell you the year. Usually 3 years old is one of the most common response that we have. Also, in International Classification of Disease, the last version, we have a changing of the terminology because transsexualism is no more in the category of mental disorders. So we can absolutely say that if I am a transsexual, I'm not a psychiatric patient, and this is part of the chapter called the sexual health condition. In terms of number, we can say that we have about 1 in 10,000 male and 1 in 30,000 females. So it's a phenomenon not so common, but in day by day, I mean, the number are going to change. We could begin with a very sociological and cultural consideration of why, but this is our data in this moment. So gender dysphoria is a strong, pervasive, and persistent identification with the opposite sex associated with anxiety, irritability, and depression. Individuals with gender dysphoria present a desire to change their bodies through medical or surgical intervention to align them more closely with their gender identity. They always talk about them in terms of biological accident, and they feel to be trapped in a body, in a different body of what they think to have. We still don't know enough about etiology because we don't have enough data about the phenomenon because, as you can understand, the scientific literature is very modern. We have data that seem to see the transsexualism characterized by specific neuroanatomical changes, genetic predisposition, and according to some literature, also psychological and sociocultural factors could be involved in the transsexualism. In Italian, we have a specific journey to transition because, as you can understand, I cannot decide to change my sex and to change my gender, and I can do by myself. The first law in terms of rules concerning the rectification of sex attribution is of the 1992. Then it was modified. Very briefly, the first step is ask to the court the authorization to change the sex through hormonal and surgery treatment. Judge has to ask a certification made by public mental health service, and can usually, Jude does it, can ask a second consultant to be sure of the diagnosis. If both the certificate speaks about the presence of gender dysphoria, the judge uses the ruling favorably granting the request, authorizes the person to undergo the procedure, and orders the change of the name and update their gender marker on their documents. From this moment, the patient can complete the gender affirmative surgery, change of gender and name on the registry office. If the person was married, there is a delayed immediate of the marriage, and there is a divorce from the people who was married. In 1911, there has been a little bit modification of the law, because today people can change name before the surgery intervention, also in absence of the intervention. We have some contrary data, because usually our patient needs to be helped as soon as possible because of they suffer. But we have data that are not so clear, and our opinion is that cannot be enough clear today. This is a newspaper of some year ago, when a very young girl, she was Alessia, she was just 17 years old, was authorized, she and his parents who asked for her because she was too young to do by herself, she was authorized to begin the transition even if she was so young. And the judge talked in terms of respect of her psychophysical well-being. But, as you know, Tavistock Centre is living a very difficult moment in London, because some years ago, Kira felt a boy, and at Tavistock Centre, that is aimed to help young people to transition, helped him to become a boy. But just 7 years later, when he was a boy of 23 years old, he changed his idea. He said that it was too young to understand what was good for her. So now she accused the Tavistock Centre because a physician didn't help her enough to understand it was the right way for her. From Kira, a lot of other patients advanced the same request, because their opinion actually is, how can you think that so young people can be so sure that they are doing the right choice? Not always can be so sure, often, but not always. For us, is an important point of view, because in our clinic activity, we try to understand together with our patient every time which is the right choice, and we help them to understand as more as they can if there is really a gender dysphoria. This is our team: Professor La Barbera, Professoressa Cordova, I, my colleague Giuseppe Maniaci, who will speak about our data later. Marta Pomar, she is a psychiatrist who is a part of our outpatient service, Laura Ferraro. Giovanni Zabbia, who is another plastic surgeon, and our endocrinologist, who is Stefano Radellini. Our patients meet us in every step of their journey. We have met until today about 19 patients. Of course, more than 2 years, our outpatient service was closed because of the pandemic, so a lot of the activity were stopped, and Enrica knows as well what it means for all us. We have met 46 trans men, mean age 32 years old. About 10 of them have completed the gender transition path just because of the pandemic. So all the units of our hospital were closed and changed in COVID unit. So also the plastic surgery became a unit for pandemic. So now they have gone back with the usual activity, and there is, in this moment, a long waiting list for our patients. When we decided how to proceed in the assessment and the treatment, we chose to use the protocol of the Standard Care of World Professional Association for Transgender Health that recommend which kind of treatment and assessment should be used with the patient. These are the units that are involved in our activity: plastic surgery, psychiatry, endocrinology, also legal medicine, gynecology, and urology. Our aim is to ensure to our patient to have a multidisciplinary care, because we think that they have a very different needs and very different level of needs that have to be considered by all of us. We want to give a multidisciplinary approach, a multi-professional approach. Our patients usually arrive from all the south of Italy, because from Rome, we are the only one center who is able to give this kind of assistance. So we receive people from Rome, from Naples, from any other city of the south of Italy, and we try to give the best of multidisciplinary activities. We are trying to have data to know something more about the etiology, even if it's not so easy in terms of diagnosis, to make better care and treatment. And also we are trying to make a network with other services of our city, also in terms of not only of hospital, but territorial services. And we try to make an humanization journey in our hospital, because we are absolutely aware of the needs to avoid the stigma for our patients, also in the hospital setting. In terms of what do, we meet the patient the first time at the unit of plastic surgery. There is usually a clinical psychologist and the surgeon. Then the first step of the evaluation is made by us. We are a team made by clinical psychologists and psychotherapists and psychiatrists. We meet patients about 2-3 times to make the assessment. We work together with psychiatrists, so interview and assessment usually are made together, and the patient receive a lot of questions, sometimes too much, but it's the only way to make the best for them, because we need to understand if there is really a gender dysphoria. Assessment is made usually by a test that we are going to see, and then we invite our patient to make a psychotherapy, especially if they are young and they have never had a psychotherapist before. Because transition is not only related to the change of gender and sex, is a revolution, so patient has to be sure of what is going to do. We have to be sure that can be able to meet all the adversity in terms of surgery adversity, complications, in terms of physical pain, and also in terms of what do you think that you will be after, which is your expectative about your future life in a new body and in the new sex. So psychodiagnosis, as you can see, is also made not only to certify and give the certificate to our patient to the request of a court, but also to be sure that patients don't have other psychiatric disorders like schizophrenia, like bipolar disorder, because according to our point of view, it can be a very controversial situation because we are not sure that can be able to cope with the situation of the hormone treatment in terms of change of the mood, and also the complex situation of the plastic surgery. Also, low level of IQ can be a problem, but with every patient, we try to understand the best. So these are the general point of view, but for every patient, we consider the situation. Psychotherapy assessment, Rorschach, I think many of you know this test. It's used to diagnosis, but also to personality knowledge. We want to know which kind of approach, in terms of affective approach, cognitive approach, social approach, is typical for the patient, and also if there is some clinical data that opposite to our condition, our point of view. We evaluate also body image, self-esteem of patient, and general quality of life, because we try to make a retest after and to see if the change of body can determine a change of the self-esteem and the wellness with the body. Psychotherapy, according to some point of view, psychotherapy should be aimed to be, yes, you have gender dysphoria. I test this, I assess, and I can write. Our approach is not based on the present, just to confirm or deny. Our approach in psychotherapy is to help patients in a journey, personal journey, to be sure, and sometimes, not often, but sometimes, some patients arrive at the conclusion that it's better to avoid in this moment any kind of treatment because maybe he is too young, is not so sure to be, or feel confusion. So our psychotherapy is guaranteed all the time they need. We avoid to say, okay, we make 8 sessions and then that's okay, we have finished. It's different if a patient has already done a personal psychotherapy or is doing a psychotherapy in other service. Sometimes our patient can need a psychopharmacotherapy, and in this case, our psychiatry use to administer drugs for our patient, so they become a patient for us like all the other patients. This is the first part. I really thank you for your attention. Is okay for the time? Okay. Thank you very much. Have you got some question? Marta, vuoi questo?
Thank you for the lovely lectures. I was wondering, do you have any data or experience with people who choose to detransition? Detransition. Reverse, yes. Oh, really?
Can you hear me anyway? Okay. It happened just one time. It was a male who became female. She was about 45 years old, and it was one of the reasons of this outpatient service, because our colleague of plastic surgery had a really stronger legal problem with this patient, because she looked to be sure she was not so young, but what happened later wasn't different of our expectations. It's very interesting because sometimes what you wish so much in your life, when you think about what you will be for so many years, can make you dream about this. So approach of a surgeon has been changing considering this trouble, not only in terms of psychiatry, psychologists, please help us to understand better before, but also to make a lower level of expectation in terms of sexual activity, in terms of physical look of other gender. And the legal problem have been enduring for many years, but at the end the judge said that our colleague of plastic surgery didn't wrong anything.
Hi, thanks very much. So I've just got two separate questions really. One was, in London we don't use Rorschach test very much. Could you tell us a bit about that? And the other question was, can you tell us about, so in London I think that the age of transition is a lot younger, and I think people try and aim to try and help people transition before puberty. So,
okay, the first one. Rorschach is a projective test, is used to make diagnosis in a traditional way, and is made by macchie, come si dice macchie? Spots, okay? And people say what they see on this spot, and we have a computer way to have the scores. We use this and not other tests for personality because we think this is able to avoid the resistance of patient, because it's not a question, how do you feel about flowers, like in MMPI test, for example, or do you prefer car or other kind, and help us to know the personality of patient, to know his clinical condition. So we prefer to use this. And also in the past it was not so used in the research field because we didn't think it was enough feasible. Now we have different data, and literature helps us to understand that it can be used also in this area. In terms of the age, I know that in England, patients are helped to stop puberty in the beginning of the adolescence. Because the thinking is that before you begin, less the patient have pain and they can start their through life. I sometimes talk about it with our colleague of neuropsychiatry. They are not so agree, because I think that we all know that gender dysphoria at the beginning is a part of the growth of a person. And the personality is just at the beginning. The personality disorder is beginning at the adolescence. Also a kind of psychosis, also bipolar disorder. So the adolescence is a very delicate moment in terms of neuroevolution, neurodevelopmental stage. Okay, so I'm not absolutely agree. My opinion for what I'm doing with them is that it's really difficult to talk in terms of general population. This is what I think in my clinical activity. So I use this as a general condition, but every time I discuss about this. Diego.
So, first of all, thank you for the brilliant presentation, and just
Thank you,
want
Diego.
to
You are
add,
a friend.
just to add to what just Alex said about Rorschach. So I made a comment because I trained in Italy and then I moved to the UK, so I'm experienced with both methodology. Of course, we don't use that in UK, but in this particular field, I think actually is an excellent idea to integrate the assessment with Rorschach, because it's a projection test, so it explores what we cannot really evaluate with the normal face-to-face assessment with patients. And might be very helpful, especially because I was thinking during your presentation, there might be cases where a patient might not have, may have a low IQ, so it might be difficult to understand if they have capacity for doing such a big, an important intervention, but at the same time, they actually may have a genuine drive to change sex because they have, I mean, and with Rorschach you can really understand if there is an identity difference.
Given that there are many countries represented here, what is in general the age where transition is legally allowed, for instance, in Switzerland? I picked on you, but I need to come with the microphone. From Switzerland, I don't know. I know you are from Switzerland.
Yes, I represent Switzerland now. And I should know the answer, but I don't, because I've had a talk about this topic from one of the specialists for transgender just a month ago. I think I remember that it's 18 still, but the process starts earlier. But don't put me down on this. I would need to look it up.
Australia is next. Who want to speak for Australia?
I've worked with transgender. I'm a psychologist, and I've worked with children from the age of 8 years of age, and where the parents have decided to go through the hormone treatment. So I don't know the answer to it either. I just work together with the family and with the psychiatrist. But 8, yes. I don't know, but I know the hormones start off at that age. 8, that's correct. Yeah.
Any other country?
So I work in northern British Columbia in Canada, and there's quite a strong movement, I would say, there to recognize transgenderism and respect people's rights. And so quite a lot of kind of thought and education about how to delay puberty to give the child a long time to decide what they want to do about that. So I'm not sure of the age of the surgery. I think the surgery is probably delayed quite a bit, but certainly hormonal treatment would start quite early in order to delay any kind of pubertal changes.
Secondary sexual character.
I think in Sweden we give them the puberty delaying growth hormone. No? Yeah, so we give growth hormone to delay puberty, and then if they still have a gender dysphoria at 16, we give them the cross-sex hormone treatment, and then at 18 they can be the surgery, yeah. And we have had a rise, I think, since 2008, rise of 1,500% in children with the gender dysphoria.
I just looked it up legally in Switzerland now. Since a year, it's 16 where you can decide for your own. Otherwise, if you're younger, you need a legal guardian. But with 16 or older, you don't need consent from anyone else.
What about Ireland? Do we know in Ireland?
Well, again, I'm a forensic psychiatrist, so not my area of expertise. There may be other Irish colleagues, but as far as I know, we don't do any gender surgery interventions. It would be in the UK, and so we'd be following mainly the UK guidelines. But I know in Ireland there's a lot of concern about people who have transitioned and are regretting it now. So about whether or not we need to delay the age of transitioning and maybe do more interventions to help people make a more informed decision.
Any more Irish that want to comment on Ireland? Ronan, want to say anything?
I think it's more or less what you've said, Dervla, but I think in terms of because it's different, mental health there can make the decision at 18, but in terms of surgeries and stuff like that, physical health is 16. So I think there's a little bit of a gap in terms of what you're legally allowed to do between ages, whether a hormone is earlier and then surgery is later on, or vice versa. I'm not 100% sure, but I think psychological interventions do start quite early. They do start really, really early.
Is there anybody from United States? No. Well, it's better, because given what I heard this morning from the potential new candidate for president, it's better not to discuss where they're heading towards. But anyway, I have a question, Erika, and then, so I was thinking about the service you provide, and I was wondering, do you have any plan to develop a peer group?
Not yet, but we could do. Yes. Giuseppe?
Giuseppe?
Where are you? What do you think about big peer group for our patients?
Well, maybe we could ask Enrica.
And Enrica and Gabriele, che ne pensate di un gruppo tra pari?
I think it would be pretty useful to share experiences with other trans people, and we could offer support to each other, which is something we really need.
Enrica?
I totally agree, and I think that since I tend to, go out with all ages, gender people, and understanding also the experiences of a lot of trans people would be so helpful for me. So I would totally agree with this idea. Yeah.
You convince others, so we will do a peer group.
I thought about this, Enrica, because I don't work in this area, but I work with young people with psychosis and cannabis use. And for them, it's very different to hear from me my opinion about the effect of cannabis than from people who are sharing with them, I guess, the interest in cannabis, but also the experience of psychosis. And for me, to see them interacting has been, as a clinician, also a learning curve to interact with them in a more person-centered way, which is what Erika was saying, where you are individual, you're not necessarily a population that can be seen as a whole. So that's what I thought, and I wasn't sure if you had already developed this idea. But now something special is about to happen. Am I right? So Laura, you know. So I would like to invite Enrica and
Gabriele.
Actually, Enrica and Gabriele, before you do this, because we also have people on streaming, and as part of that, this has been recorded. Are you happy with that? Because you don't mind, okay? Because otherwise, I think changes can be made. And this is for you now.
Puoi accomodarti al centro, qui dove c'è il tuo bicchiere già pronto. Il microfono. So welcome, and thank you to be here, for being here. I know that it's very difficult to share one's life, and probably this is even more difficult. First of all, I want to present briefly who they are. Okay. She's Enrica, this 3 years old little star, and now she's 23 years old. She's a linguistic mediator, so his language is better than mine, probably, and desires to follow up her career in a specialistic graduation course. And she started the official transition in 2021 and the hormonal therapy in May 2022. And he's Gabriele, another 2 years old little star, 25 years old man. He's writing his thesis, actually, on communication science and marketing. He started the official transition in 2019 and the hormonal therapy in 2020. We decided to do some questions, guided questions, so we can be less anxious, probably. So when did you start to perceive a mismatch between the sex assigned at birth and your gender perception, and what aspects made you perceive it? Yeah, you can decide who starts.
I started understanding that my birth assigned sex didn't correspond to my gender identity since I have memories, basically. So, like when I was 2 years old, so when the brain starts working and you have the first, memories and the ability to understand things better, I knew that something was wrong, and but of course, in Italy, people are ignorant, basically. Not all of them, but most of them. And topics like these, like being transsexual, wasn't, people didn't talk about this topic. So, of course, in elementary school, when I was 6 years old, people tried to convince me that I was gay, homosexual. Of course, this wasn't homosexuality, and but in some way, I started to believe them, and I was very sad because I didn't know what was the truth about myself. Basically, since the beginning of my life, this is the answer. So, okay.
For me, I think I started really understanding that my gender identity didn't match what I look like to other people was when I was 5 years old, and I had already received so many gender stereotypes from everyone around me, and at that point I believed that only women had feelings because that's what I thought at that age, based on the people I had around me. And one day I told my mother that I was a boy but with the feelings of a woman. So I think that started to make her understand that I wasn't a girl, and I think they didn't have the instruments, the knowledge to help me through that. So I lived all my puberty years struggling because I had a lot of envy towards my male friends who were going through male puberty, while I was going through a lot of changes that I didn't want in my body. And I also struggle a lot because people perceived me as female, and I didn't feel like a girl. I was really happy when people called me he, because I was really androgynous. But every time my parents corrected them, and that was frustrating.
Oh, well, thank you very much. And how and when did you share this experience with your parents, friends, and how did react? How did they react?
Okay, I have a very similar experience with him, and I remember when I was 4 years old, remember telling my dad, Dad, I feel like I'm a girl. And of course, he didn't believe me. He thought that this was a phase, of course, it will pass. And then I, try to forget myself. Let's just pretend that this is not true. Let's just forget about it. So this was the first time I came out. Then when I really was conscious about my real identity, I remember it was like 4 years ago, because I felt like it was more it was easier to convince myself and also other people that this was homosexuality, just not to explain too much. Of course, I felt like this was totally wrong, for me especially, and I started saying I'm a girl and I've always been a girl. So I told my parents that this wasn't a phase, this is, and that I think I will never, go back with this decision. So this is the right thing to do. I should have decided this many years ago, but I wasn't brave enough. And of course, I'm just like him. I was very happy when people started calling me as a girl, of course, because I'm very female-looking, as people tell me. And so, yeah, this is basically the answer.
Thank you. And you, Gabriela?
For me, I think after my coming out when I was 5, I locked myself in the conviction that I had to be a girl because there was no other option. I didn't know trans people actually existed until I was 19 or 20 because no one talked about this stuff when I was growing up. So at one point, I told one of my best friends when I was like 19, I don't know what's wrong with me because I don't feel like a girl. I hate when people call me a lesbian because I like girls, but I wasn't a girl, so I didn't feel like a lesbian. And this friend of mine told me he would start calling me he, so we could see how it goes. And basically, I had told him that my parents wanted to call me Gabriele when I was born. If I was assigned male at birth. But when he heard that, he just said, I'm gonna start calling you Gabriele, and we'll see how you feel about that. And that made me feel actually great. But my real coming out came months after that because I also didn't feel brave enough. But I was afraid that everyone around me would just abandon me. And thankfully that didn't happen.
Thank you. We know that you both have fantastic families on your background. However, did you ever experience some bullying or discrimination, something similar?
Okay, not like violence in this sense, but yeah, especially during school years, schoolmates and classmates really wanted me to feel wrong. And yeah, I don't know if this can be considered as bullyism, but in some way, yeah, discrimination, of course. So, yeah.
Thank you.
I think I mostly suffered from bullies and discrimination when I was in middle school because people perceived me as a really masculine girl, and they didn't like that. So those were tough years because there was a lot of discrimination, bullying, even online, and also sexual harassment. I think that's a very big problem in our schools. And when I started high school, I was the first person to come out as LGBT in my high school, which is wild. And basically people look at me as if I was an alien, and that was strange because I felt like everyone stayed away from me, but all the eyes were on me, so that was really stressing.
Thank you. At which point of your transition are you now?
Okay, as you said, I started hormone replacement therapy in May 2022, and thanks to the certificate that you provided me, I'm going to start my legal procedure. So I, of course, called a lawyer that is going to help me with the judge and with the legal process in order to change my birth name and also to have the permission to operate and have the gender-affirming surgery. But I think that some here will pass for this step of the transition, but for now, I'm quite happy with what's going on with my life recently. So for me, it's fine.
I started hormone therapy when I was 21, I think 22. So now I'm 2 years and a half on hormone therapy, and I've had surgery in 2021, and I recently got my new ID, so that's good, and I'm really happy about that because it took me 3 years. So.
Okay. What expectation do you have for your future in terms of life, and not only in terms of transition?
I hope I will work and have a job that satisfies me, of course, and just to wake up in the morning and feel not happy, because happiness is something really hard for everyone. No one is really happy, but something that is near to happiness. Of course, it could sound I don't know, banal, but I hope I find a partner in my life. Some guys already would want to be with me, but of course it's very difficult for their families and for my genitalia. This is what I expect someday, but just to be like just walking down the street and feeling fine, without feeling the highs on me, just feeling normal, even though this is an adjective that I don't like a lot, but feeling normal sometimes is the best present life could give you, and this is what I would want.
Thank you. Thank you.
Right now, I'm actually, as the doctor said, I'm writing a thesis about trans people, actually. It's a thesis about the relationship between institutions of education and trans people, because I've struggled so much at middle and high school because of my gender identity. So I think that's a thing that needs to be addressed and assessed by research. And we're doing interviews to trans people that are actually helping us collect a lot of information. So I think that's something I'm really proud of right now, and I hope to graduate soon, probably in March, and then I don't know what I'll do, but I'll look for a job, I think.
I think it's enough.
And for my future, I'm also hoping that everything proceeds in the right way, because I already have a lot of people who support me, so I think they stick around, especially my partner, who I've been with for 6 years. So I think sometime in the future we will get married.
Wow.
So.
Wow. Good luck.
Sure.
Enrica.
Okay, now we want
Enrica, it's a very normal idea. Are you agree with me?
Yes. Now we want to reverse the situation, and we want to invite you if you have some question for the audience.
Maybe I can suggest, is there anything you think we could do to change? I mean, many of us work, well, I'm not a child psychiatrist, but we often work with children from developmental age, or we are asking your opinion on what would be a better environment for children to grow up in relation to many negative aspects of society. So if as psychiatrists we could give a contribution to make a difference from future children that are born today or tomorrow, feeling the way you felt about your gender identity at school, what do you think we could do to change that?
I think an important part of support, of psychological support, is language. And I don't think that's really highlighted right now. Because sometimes transition is talked about as a passage from one sex to another, or he became a she, something like that. And I think that's kind of disrespectful, because I think trans women have always been women, and trans men have always been men. Also, one thing that's not addressed a lot is non-binary identities. And that's something that I think we're starting to understand in these years. So I think we should do a lot of research on that and try mostly to just be respectful with people, learn how they want you to talk to them, and how they identify, how they refer to themselves. That's an important part, I think.
Your question actually is very interesting, because when I was 7 years old, I started path with a psychiatric, and I wasn't brave enough to tell I'm a girl, and that's the truth. And my parents, this was my parents' idea, to go to her and trying to find the truth. And I would suggest professionals like you should be braver than your clients, because sometimes your patients aren't brave enough to be very honest with themselves and with you. And of course, I was too little, so when you are 7 years old, it's too difficult to tell you, I'm a girl, because maybe you are not sure yet about it. But if you feel that this is the truth, you should be brave enough to say you are a girl, but even though you don't want to admit it, you are a girl. And I haven't been this lucky, because this psychologist told my parents that this was a phase, and that my dad was also the cause of me being so female. You know why? Because he puts, come si dice, accavallare le gambe? Yeah.
Crossing it.
He crosses his legs, and so I saw him doing like this, and so this was the reason why I was female. Like, this was so confusing and so stupid, and I'm quite shocked that these people work, actually. So you should be brave enough to find yourself a diagnosis and say, this is the truth. If you want to, embrace it, well. If you don't want to, you can go away. I mean.
Yes, thank you very much. And do you have any question for the audience or not? No. Yeah.
Maybe to the girls in this room right now, if you, like I talked now, and if you feel, when you look at me, of course, if you feel, when you hear me talking, a difference with me right now, I'm just curious about it. if you look at me and see something different from you, or something, that doesn't involve your same sex or gender identity, or if you feel me like something.
But I can tell you from my point of view, the main difference between the two of us, you're much younger and much more beautiful. That, the answer is no.
No. Okay. Yeah, now the audience, if the audience have questions.
Don't mind.
Yeah.
There's been lots of debate in UK, which is despite being Italian, where I live now and work, on what you should do in school in terms of what is in UK is called gender education. So there are some schools that don't want any gender education, and there are some schools that are debating if you can talk about all the different stages of development and identity, sexual identity. And there's been lots of controversy which often relates to the school, lay school or their religious school, and each religion comes with their own belief and their own pros and cons. From your point of view, if you go back to your experience, do you think there is an age where beginning to have a conversation, I don't know how detailed, this is something that maybe could be discussed, it would be helpful to have some awareness of how gender identity is not at all binary or tertiary, but much more complex and fluid?
So you mean since elementary school?
You tell me, what age, if you go back in time, what do you think it would have been useful for you to have a conversation, for your peers to understand, for your teachers to understand, and maybe parents to understand that this is a conversation that it's necessary. It's not a taboo that should only be discussed one-to-one with a psychiatrist or a psychologist for your daughter or son.
Okay, back when I was 7 years old, it would have been very helpful for me during elementary school to have classes that were about this topic. But, it's just easier to just pretend that these things that don't exist. And also because I'm quite sure parents would have been very angry about this stuff. Because people, especially here in Italy, think that the more you talk about this, the more people will, for some strange reason, become also LGBT. This doesn't make any sense. We can talk about something and be external to it. But of course, just to sensibilize, just to make people conscious about these things, it's very helpful. Maybe if some parents find it way too much, not in elementary school, but in high school, sex education, or in middle school, that, during the first years of being a teenager, stuff like this is fundamental to help young people understand themselves and also the others, and learn how to respect other people and their classmates in general. So, yeah.
I agree with her, and I just want to add one thing, that I don't think there is enough psychological support in schools. And if there were specialized psychiatrists, psychologists who can help students understand themselves in a part of their lives that's very confusing, and it's hard to understand these kinds of things by themselves. So I think psychological support that is consistent and that it's always there in school, I think it will really help.
Thank you. Any other question?
I'm Rose from Australia. Look, I'm very proud to say that in Australia we are doing some fantastic work with transgender. With schools, I've worked in schools for a long time, and schools are very open to it. And we have a lot of programs in educating young children, educating families and parents, because when we have children as young as 8 transgendering, there are a lot of factors you have to take into consideration. Like you said, the population of the school and the community, school community, that's a big challenge. But I can just say that we've really overcome a lot of it, and it's been really, really successful. And it's just about planning and having everyone work together, including the school, the community, the government, the psychiatrist, all factors of the health profession to work together towards it. And we've come up with some really great programs. So if you're interested, we've just before coming here, my colleague and I put together a program which we introduced at a school level, and it was a first because we were able to introduce it in a state school, the actual conference, and it means that the government actually approved it, which was a first because everyone was really scared of the legal implications and all the backlash from the media. That was very worrying. So I thought that was really great, and it came out, it turned out really, really well. So I think having a really good plan in education is the first step, because it's going to really reduce any anxiety and depression in a lot of young kids that I see.
Rose, is this program, do you have a website? Is it something you share it with me? Maybe I can share it with the team. Erika, Rose is saying that this program that they have developed is available, so Rose will share it with me, and you might like to have a look at it with Erika and Gabriele.
Okay. Thank you very much.
So there is a link also to a film.
Thank you very much.
Any more questions? Well, it's been a real privilege to have you both sharing your experience, because that's how we can learn to do our job better as well. And thank you very much, of course, Erika and Laura, for the work.
Yes, we have this last chance to leave a take-home message from you, obviously, to the audience. So, to you.
Enrica, sorry, I called you Erika. Sorry about that.
Okay, I'm quite convinced that people in this room are very respectful for trans people. So maybe I should leave a message to people outside of this room. But you know, I would like you just to remember that, because I'm very sad when people link being trans with you know, prostitution. And when you ask me what I expect in the future, I told you having a job that satisfies me. And when I talked about being normal, that was exactly what I meant. I am a woman and I will work as a woman. And this is something fundamental for everyone to understand. And sometimes knowing that people think that a trans woman can only be a prostitute is so sad, because of course no one will, you know, give them a job, a normal job. So once you don't have other opportunities and other options, what do? This is so sad, and yeah, this is a message that I would like to give you.
Thank you very much.
I think my message right now, because I heard Enrica, and I've been thinking about the violence against trans women a lot, because interviewing other trans people, I've heard bad stories, and I think as trans men, we don't suffer from that violence because we reach a level of privilege in society that is different. For trans women, actually, it's like going a step back, because sadly our society is sexist, and I think what we should really work on is trying to treat trans women in the right way, so it becomes more normal, as you said, and not such a stigmatized thing, because I think who suffers most from transphobia is actually trans women, because they're more visible and they're more scrutinized, and basically the weight of the word trans is all on their shoulders, and I hope that's not the case anymore.
Just like gay men, of course, lesbians are a lot less discriminated compared to gay men. This is the same.
Yeah, probably yes. Thank you very much.
Thank you.